We're dynamic. We're actively exploring.
It's a lot more nimble and a lot more exciting and innovative.
Ask the impossible question and see if there's a way we could make it happen.
It's almost like a snowball. It keeps rolling, gets bigger.
Go out and try different things to create that model that doesn't exist yet today.
There's an energy level here that you can feel. You can almost taste it.
Never be satisfied with the status quo.
While our NIH funding and sponsored programs are going up, across the country they're going down. I think that speaks to the innovation happening on our campus.
And what I do is I work on Parkinson's disease, and so it is a movement disorder that is neurodegenerative. And what we want to do here is basically develop new compounds that actually will slow down the disease progression.
We've been focused on 4 research areas, and over the last several years, the funding and the discoveries have been really growing.
In a lot of neurodegenerative diseases, whether it's glaucoma, Alzheimer's, Parkinson's, what most of science has been focused on, where we've been trying to target to intervene for better outcomes, is protecting that cell body.
Some anti-diabetic compounds can be modulated and modified to do this, and so we've been very excited about finding new compounds, synthesizing them, testing them. Some of the pharmacy students who do come help with us in the research endeavors, so that they can get a better sense of what research means, as opposed to somebody who may have never had real contact with a bench.
If you look at the NIH funding, we bring in more research dollars per faculty member than anyone. We can stack up against any major research facility.
When we find something new and something novel, we can then go and immediately teach that to the students in lectures.
In the community setting, we're still very siloed. We still have the physicians in their offices and the pharmacists in their pharmacies. If we can demonstrate in an academic setting like NEOMED that education and training can be done together, we can roll that out in the practice setting.
Year 1, these people are sitting in the same classes, taking the same exams, and complaining about the same professors.
We were giving the freedom to pursue these new ideas and then to train these students in ways that we think is much more agile, much more beneficial to them to become better clinicians.
So how do we better integrate pharmacists in that healthcare team, where we can go and engage with our partners in the region, working with them to say, where are your gaps of care? Where can we help you improve the care that's being provided?
We were actually the first community residency in Northeast Ohio. There's several others that are across the state, but we were the first one in Northeast Ohio.
It's the idea of different disciplines taking care of patients and coming together to say, how can we take care of this patient the best? So here at Akron City, I have the opportunity to work with medical residents, pharmacy residents, students in both, attending physicians, and my colleagues that are pharmacists. If somebody has uncontrolled hypertension, it may be a pharmacist that's best to speak to that patient and to assess maybe there's a reason why they don't take their medicines.
We believe it's absolutely part of our role to understand what's happening in our community and find ways to reach out, use our expertise to make a difference.
We have over 50 student organizations here on campus, and everyone is required to complete a service-oriented project throughout the year.
We don't just work here, we live here. We raise our kids here.
February, there's a nationwide Script Your Future Awareness Month, so this deals predominantly with non-adherence or not taking your medications as prescribed. We contacted the governor's office and they did a Take Your Medication Day, so governor proclaimed statewide, and we were the ones that were pushing that forward.
We're probably the only one in the country that has a rural STEM high school located on a university campus. Very much integrated with our medical and pharmacy programs. My ambition is that NEOMED will be known as a game-changing sort of institution.